Good day everyone, I am Rohaimadi Tado and today I'm going to show you how to do an admissions of the patient. So first you need to prepare the unit as soon as notified by the clerk. And then second, you need to prepare the bed for the cleanliness. You must check for the free wrinkles to have a comfort of the patient. Third, you must check for the closet and then the toilet for the cleanliness and the functionality. And fourth, you need to assemble all the needed equipment and take to the unit. So I have a thermometer, the stethoscope, the sphygmomanometer, and then the drinking glass with spoon and fork, and then the teaspoon. I have also have a pitcher with water, and then face towel, hand towel, and the bath towel, and then the patient gown, and then the bath soap, and then toilet paper, kidney basin, and then bedpan for the girls, and then urinal for the boys. So it must be properly near to the patient to prevent in giving or to prevent delay in giving care of the patient. And then next is prepare the bed for the patient comfort. And then next is you need to wash your hands. Then you must remove your jewelry or your watch. So I'm gonna hand rub my hand using an alcohol to for the infections control. So I'm gonna hand rub with alcohol. And then you must receive the patient, introduce yourself, and you must establish nurse-patient relationship. Morning, ma'am. May I know your name, ma'am?
So my name is Rohailin.
Ma'am Rohailin, thank you for that. I am Rohaima Dictado and I'll be your nurse for today. And this time, we will change your clothes into patient gown. Is it okay to you, ma'am, or your relatives will be the one to change? Okay, thank you for that, ma'am. Kindly stay here. Thank you. And in changing the patient gown, you must strip the curtain. So, to provide privacy, and it is to make sure that the patient have privacy of her body, because if there is an exposure, it could might anxiety for her if someone will look at the body. So you must provide privacy. And then changing. So this is just imagine this is a patient gown. So ma'am, can you raise? Thank you. Thank you. And then you must lock here. And then assuming that it is in the back, so you must lock. And then you must assist the patients to the bed. Okay, ma'am? Okay. Okay, ma'am. Okay. How do you feel, ma'am? Are you comfortable? Okay, thank you. The step is you need to take a vital signs, and you must first do an hand hygiene using an alcohol, and then after that you need to wear a watch again for the vital signs taking of the patient. So imagine or assuming that I take the temperature, the pulse, the respirations, and the BP of the patient. And after that one, you need to record that to the TPR sheet. You must record whether it is normal or there is an abnormalities. And then after that, you need to wash hands again using an alcohol, or you can wash your hands with soap and water. And the next step, you need to orient the patient about the unit and the personnel, because the patient have an adjustment to the hospital, and it may affect his willingness to cooperate in the medical. And then, good day, ma'am, again. I would like to introduce to you the unit as well as the personnel in this hospital. So first, ma'am, we have a call system. So you must press that, ma'am, located at your right side, that one. If you have anything that you need help or assistance, just press that one. If you have a doctor or the nurse, just press that one. And then next is visiting hours. So we are allowed to have visitors at the 9 a.m. to 11. Then in the afternoon will be 4 to 6 p.m. Please tell your family members or your relatives that beyond 6 p.m. we are not allowed to have a visit anymore. And then next is you need to have meal time. So in meal time, the breakfast will be at the 6 a.m. and then your lunch time will be at 12 noon. I mean 11 a.m. And then next for your dinner, ma'am, in the evening will be served at 6 p.m. And then next is for your bathroom facilities, ma'am. It was located here at the right side. And then if you have anything, if the doctors has an order that you are not allowed to go in the bathroom, you must stay at your in your bed, and we will gonna use bed fan for you to assist. Okay, if you have anything that you have difficulty urinating, you must call me or just press that button. Okay, and then next is use of appliances. So you can bring your own appliances, but there will be a charges, and please inform us because that charges will be added in your bill. And then next, bringing from home food. So it must preferable that it should be prescribed by the doctor. So please tell your family and your friends. Okay. So you have any clarifications, ma'am? Okay, thank you very much. Then you need to assess the belonging of the patient. You need to leave the patient comfortable within the reach of the hole. And next step will be obtain patient health history and the complete nursing assessment to provide the baseline assessment. So you need to observe the signs and symptoms for the distress. You need to also to take the vital signs, especially for temperature, respirations, and the pulse. And then lastly, BP, and you must take also a height and weight of the patient. Good morning, Ma'am Riley. So did you know me, right? I'm Rohaima, your nurse for today. I would like to ask you, ma'am, how's your day here in the hospital?
I have a problem, ma'am, about
Okay, ma'am. What is
Ako ko'y problema, ma'am, about sa kung kuan, ma'am. Then, need, kaya dili kayo katulog, ma'am, ba? I need kayo na ko ang medicine, niya. Saba kayo ang palibot, and then, kuan pud, ma'am, kanang every mukuha ang nurse sa kuha, ma'am, madisturbo pud sa kuha, ma'am, ba? Niya, dili kayo katulog.
Okay, ma'am. Thank you for that, ma'am. So I understand your situation right now, ma'am. Actually, we get your vital signs in order to determine or to monitor your health status, and so that we would know what would be the best interventions for you if ever there is a problem. And also, ma'am, if you can sleep, you can listen to the music, or you can read, or you can do a light exercise, ma'am. Just raise your hands and then do like that. You could even do a massage for you to relieve and to give you properly sleep. And also, ma'am, don't forget to don't drink water at night before sleeping, because this may disturb you in sleeping because you can urinate at night, so it's probably you will wake up for that reasons. And your in your medications, ma'am, it will be served at 8 hours for the nurse. And to get your vital signs, you must be prepared at the 8 o'clock in the morning and 12 o'clock in the noon, and in the afternoon will be 3 p.m. Then onwards in the dawn, we will get your vital signs. You must be ready for that. And also, ma'am, if you don't like a disturb for your sleeping, I will just put your silent area at the door so that you would not disturb anything. Okay, ma'am? Is that
Okay.
okay to you? Okay.
Okay.
Thank you very much for your perspective, ma'am. Okay.
Thank you.
Next morning. Good morning, Ma'am Rohailin.
Good morning, nurse.
How's your day, ma'am?
I'm okay na, nurse.
Wow, that's very good to hear.
Thank you so much, nurse, kay nag-care gyud ka sa kuha, and then maayo na jud ako ang pagtulog, and then naayo na jud ko, nurse. And thank you kaayo sa pagtabang ni nako.
No.
Naayo na jud ko, then na-effective na jud siya.
No problem, ma'am. Basta ikaw. And also, thank you for participating to me. Thank you.
Thank you, nurse.
For the format of DAR, this is all about the data, the actions, and the response of the patient. So here I wrote the name of the patient and the room, and then the date and the time. So it is May 6, 2020, and assuming that I get this from 10 p.m. in the evening. And then one of his problems, so she has a difficulty in sleeping. So the DAR, or the data, so the D stands for the data. So the patients asked for the medications for her to sleep, and also the patient stated that she is worrying too much about her condition. The patient also stated that it takes me an hour to go to sleep and it's very hard to fall asleep. The patients also complained that the noise in the ward is not helping, and the medication to take and the nurse coming in to take my vital signs and make getting enough to sleep. So my action is allow the patient to talk about the anxious feeling and the concerns about her conditions. And you need to place the patient in a room away from any distraction and the noise. And also put a sign in the door silent area. And then you need to introduce relaxing activities such as calm music, reading books, or relaxing exercise before the bedtime. Then inform the patients about the schedules and the significance of the medications of vitals taking. Remind the patients to avoid taking a large amount of fluids before bedtime to avoid waking up to urinate. And then the response of the patient is appear relaxed, and the patient verbalized the understanding of her conditions and the repeated of the K-point from the patient teaching, and the patients fell asleep and understand the importance of vital signs taking and the medication that noted by the schedule. Next is you need to inform the attending and the resident physicians to facilitate the proper management of the client. And next step will be carry out the orders as by the physicians given to start or provide the medical management of the client. And then next will be carry out, plan the individual care as based in the patient's need to have a proper nursing interventions. And then next will be the next step will be reassess the patient level of comfort and the ability to adapt the hospitalizations to provide or to reduce the anxiety of the client. And then the next step is you need to notify the kitchens for the admissions of the patient to make sure that the patient follow the prescribed diet. And then you need to record or document all the findings about the patient, including the time of the admissions and the time of arrival, and also the conditions of the patient. You need to also assess the objective data and the subjective data of the patient, and you need to take the vital signs, temperature, respirations, and pulse, and the BP you must take also. And you must also record the height and weight of the client. You must also assess for the appetite, the sleep, urinations, and the bowel movement of the patient, and also so that to promote the continuity of the care that is given. And also you must have inform the health team, or I mean the health care team for that. And also, lastly, you must wash your hands for the infections control.